Hi, we're here with Nancy and we're going to do her transformation today. So we're going to kind of hit all the areas, and she and I had a little discussion. We talked about what bothered her. So let me just go through the analysis of what we decided on. She's got the fine lines of the forehead. You know, those are caused where the muscles are stronger than the skin, and so that results in these lines. So if we can relax the muscles with Botox, then the lines soften. There's a few fine lines around the crow's feet area too, so we'll do that. She has beautiful cheekbones and she has great fullness here. And she's got a heart-shaped face, which is what we always want. So we don't really need to accentuate the cheekbones themselves. Those are the widest part of her face, which is where it should be. But just beneath those prominent cheekbones, she's losing a little fat in this area, which is making her look hollow here. So we want to fill in those areas to give her a little softening so the cheekbones aren't so pronounced. She's got fine lines around the lips, and as she told me, her lower lip is disappearing. So we want to treat both the fine lines as well as give her some more volume, both in the upper and the lower, but primarily in the lower. And then she's losing fat in this jowl area. So we want to, in the pre-jowl area, and the jowls are becoming more pronounced. So we want to put some volume back here to help camouflage the jowl and give a more natural look here at the jowl. Finally, her muscles are starting to fall in the neck, so we're going to use a little Botox to treat those platysma bands that she has there. So what I'm going to do is draw all my, well, actually the first thing we'll do is give her some numbing cream, and then I'll come back and then I'll draw all my lines, and you can watch me draw what I'm going to do on her, and then we'll do the actual procedure. I'm going to mark Nancy for the procedures we spoke about, and the first thing I'll mark is the Botox, and I like to mark that dynamically, having her move her muscles, and then we know exactly where we're going to get the best effect for her. Okay, so if you frown down like you're thinking of your husband David, there we go. Good. Okay, now relax. And I'm just kidding about David. And then lift your eyebrows. See how the lines are formed by the frontalis muscle. So we're going to soften that. Good. And then smile. And her orbicularis muscle creates these smile lines. Happy person. Good. All right. Now, as I said, she has very strong cheekbones, so we don't want to accentuate her cheekbones, but she's hollow just beneath that. So we're going to use a little contour to fill in that spot. And the same way here, helps soften the cheekbones. Then we've got the loss of fat in this area, and then the jowling out here. So we're going to help do the same thing using contour once again. And she's got fine lines of the lip, so we're going to treat that with a little Volbella. And we're going to do a little bit of lip volume for her as well. Good. Okay. And finally, we're going to do a little Botox in the neck platysma muscle. And we can get that muscle to relax a little bit and help some of these lines soften here, these bands. In the crow's feet area, so that's why I always spread it out so I can see where the veins are, because we want to avoid them so that we don't get a bruise. You can see there's a vein here and another one down there. So I'm going to go outside of this one. Good. One thing we're very careful about is aseptic technique. We want to make sure, especially with fillers, that we don't cause an infection and there's bacteria on your skin. So we use a hypochlorite solution, which really kills all the bacteria. And I'm always constantly cleaning whenever I'm doing fillers, because I want that skin as clean as possible. Contour. And I do this with a cannula, which has a blunt tip on it. It's not a needle, so I have to make a hole with a needle and then slide the cannula in, and that helps prevent bruising as well. Okay. So we make the little hole. And then I can slide the cannula through that hole. And now we're in the space beneath the muscles where the fat goes away. So we can just add the filler now. I think you can start seeing how she has a nice transition from her cheekbone down into the cheek there. All right, so look now and see her cheek. You can see how she has this nice smooth curve starting at the cheekbone and coming down to the lower cheek, right? That's called the OG curve, and that's always our goal, is to restore that OG curve. There's an inward part, an outward part, and it comes back down again. And you see that best from this 45-degree angle. We've restored her OG curve. So now we're going to fill her pre-jowl. She's got this bulging in the jowl, so we're going to camouflage that by filling in this area on either side, again using the contour. See, you can see now how her jawline is smooth, and we've filled this space. This side we haven't treated yet. She's hollow, and her jawline is indented there. So that. One of the things I've found that really helps get the lips nice and numb is using ice for the procedure. It works better than numbing cream. And I've had a lot of patients tell me they couldn't stand the injections of their lips before, but once I used the ice on them, it just really softened it a lot. So I make a big point of making sure that we get the lips nice and cold before we do the injections. Treated the white roll of the lip. I've treated the fine lines of the lip, treated the white roll on the bottom, and we've treated the little fine lines on the bottom of the lip. Now we're going to focus on giving her some volume. She really needs more volume in the lower lip, but she also needs a little bit in the upper. Ideally, you'd like to see 60% of the volume in the lower lip and 40% in the upper. So we're going to do a little bit in both. Platysma bands. I can feel the muscle edge in my fingers, and then once this Botox works, the muscle will relax and it will actually shrink upward Finished Nancy's transformation. Obviously the Botox takes 10 days to work, so you won't see anything from that, but we treated the lines here and we treated her platysma bands down below. Then we did filler, which looks amazing in her cheeks because we've softened those cheekbones. And before she had a cheekbone and then a hollow, and now it's so smooth through there. You can really see it. Same way here, cheekbone, and now it's smooth. She's got that nice OG curve that comes all the way down. We treated her pre-jowl area. We filled in, we've smoothed her jawline, and we filled in the hollow where she's lost the fat. And then we did her lips, and now she's got a lower lip again. That's okay. She's happy, right?
Yes.
So we've given her a lower lip back. We've treated her upper lip. We've treated the fine lines, and this will continue to look better in a few days because it draws a little water in there. But I think you can see a nice improvement. Thank you so much for watching.